Hey everyone, today I thought I'd give a little bit of information on cross-infection. So just really basics for the beginning. So how you can prevent cross-infection is using your PPE. So PPE is personal protective equipment. So make sure you're wearing a mask, an apron to avoid any blood splatters or saliva on your uniform, because then you're walking around with that all day. So make sure you've got your disposable apron, your mask, and either a hairnet or having your hair tied up. Another thing you need to make sure you're doing is completely washing your hands thoroughly in between every patient, making sure before anyone comes through that door your hands are clean and washed. I've got hand sanitizer as an example, but I prefer to wash them. Also is making sure your clients have got their personal protective equipment on as well, so using bibs, hair nets, making sure you're cleansing the area thoroughly with the Steri wipes. I use the alcohol-free pre-injection wipe, so I remove any makeup and creams off with a simple wipe and then really cleanse the area properly with a pre-injection wipe. I always use a kidney dish, a sterilised kidney dish, to be putting any needles in there, so I'm not placing it down on the sides where they can get contaminated. Always using a sterile kidney dish. Making sure you've gloved up, make sure you've got fresh gloves on. If you need to go and get something from a cupboard, remove your gloves and then re-glove again. If you need to take photos on your phone, do this before hand washing. So make sure you're taking the photos. Your phone harbours so much bacteria, and if you do need to use it in between, gloves off, use your phone, wash your hands again and then re-glove with fresh gloves. When I am applying any creams or anything like that after the procedure, I always kind of use these disposable little tools here just to make sure I can apply the cream on the back of my glove and just apply like this, so I'm not transferring anything onto the open wound that we've created with our injections. Also, another little tip, what I see people forgetting all the time is your needles, no, they're not needles, your pencils for marking up. So once you've used them, sharpen them to get rid of any makeup or bacteria from the client's skin on there, and make sure you're always wiping everything down after use as well. So the pumps, so make sure you're cleansing the full thing where you've held it, the full pencil, make sure you're wiping everything down, your bed fully, and everything then going into your clinical waste. And remember, keep your area sterile and clean, and no going away and opening cupboards with or door handles with dirty gloves. Make sure you're removing your gloves. Then your apron goes in the bin along with your mask, your hairnet, whatever you're using. Sharps in the sharps bin, and I hope that gives you a little insight into cross-infection.